Hey everybody, Dr. Mueller here talking about blood tests for mold illness. Now it's important to understand that mold illness is a genetic condition, and what happens genetically speaking is that our genes are not able to recognize the mold toxin. So essentially the genetic anomaly makes it so our immune system is changed and our immune system does not properly tag mold toxins when we breathe them in. So somebody with this genetic condition, real common, affects up to 24% of the population. When they breathe mold toxins in, the toxins get stuck because the immune system doesn't see them. So from a blood testing perspective, we can do tests such as an autoantibody test where we're actually looking at our immune system reacting to mold from an allergy or a sensitivity type of mechanism. And that can be useful, but most people that truly have biological effects from mold, it's not an allergy or a sensitivity, it's a toxic buildup problem. So a test that's looking for the immune reactivity from an antibody perspective, which is like an allergy or a sensitivity, is going to miss the toxic buildup, which is usually the problem. Another thing we can do in blood is we can run inflammatory markers like MMP9 or TGF-beta1. These are inflammatory markers that tend to go up when we are around mold. The problem is they are non-specific. So they go up a lot of other times for a lot of other reasons as well. So that's one of the problems with those inflammatory markers is that they're non-specific. So the test that tends to be most specific for people is the urinary mycotoxin test. The urinary mycotoxin test is a very thorough test to look at a lot of different toxins that are secreted by a wide variety of molds. It's also easy to do because urine's an easier sample to take than blood. You can do it in the comfort of your own home. So strongly would recommend that you use a urinary mycotoxin test as what you do. And remember that mold is the great mimicker, right? I work with mold a lot in my clinical practice, and it looks like a lot of different things. It can look like insomnia, it can look like early onset menopause, it can look like headaches, migraines, it can look like dementia, brain fog. People can have these depersonalization feelings where they feel like outside of their body, right? Anxiety, depression, so many different things can be caused by this. So really figuring out if this is the cause and getting the right testing is essential. So urine tends to be better than blood. If you need help with any of this, check out my clinic. We have lots of offerings for people. That information is in the show notes. And if this was helpful, please do subscribe to my channel. Thanks again. See you next time.